Welcome to the Employer Spotlight for Healthcare, presented to you by Lake County Workforce Development. The Job Center of Lake County is located at 1 North Genesee Street in Waukegan. Our website is lakecountyjobcenter.com, and you may reach us via telephone at 847-377-3450. Please call the Job Center to make an appointment to use a computer for self-directed job search. Please note that limited time slots are available. We invite you to join us on social media. You may follow us on social media to stay up to date on job search advice, resources, and job openings. We do update our social media on a daily basis. You can reach us via Facebook at Lake County Workforce, on Twitter at Lake County Jobs, and on LinkedIn at Job Center of Lake County. Our industry trends for healthcare include an increase in artificial intelligence, 3D printing, and telehealth. There's an increase in cybersecurity, big data and data analytics, and an increased need for registered nurses and doctors. Finally, an increased need for personal care aides.
Okay, now we're going to look at some labor market information. How many healthcare jobs do you think there are in Lake County? Well, in 2019, there were 31,337 healthcare jobs in our county. This number is projected to increase 7% by the year 2028. So clearly this is a growing career field. Let's look at entry-level wages for 3 top healthcare jobs. First of all, registered nurse right out of school can start out at $26.08 per hour. A medical assistant can start out at $12.64 per hour, and a personal care aide, sometimes called a home health aide or a non-medical caregiver, can earn $11.18 per hour. But please remember that these are averages, and you can, in fact, find many employers who pay more than these wages. For example, if you become a certified medical assistant, you will earn a little bit more. Now, what are the ages of healthcare workers in Lake County? Let's find out. 8.1% of healthcare workers in Lake County are between the ages of 18 and 24. 22.4% are between 25 and 34. 20.1% are between 35 and 44 years of age, and 22.2% are between 45 and 54 years old. Now let's look at the gender breakdown. As you can see, 78% of healthcare workers in Lake County are female and 22% are male. So if you're a male interested in healthcare, you may have an advantage. There are many different career paths available to you within the healthcare industry. Let's take a look at some of the most common ones. First, therapeutic services. These are jobs like certified nursing assistant, medical assistant, pharmacist, and paramedic. Employees in these jobs provide care and treatment to patients. Individuals working in these roles need strong communication and problem-solving skills, along with quick thinking skills. The next category is diagnostic services, which include positions like phlebotomist, that's a person who draws blood, dental assistant, and ultrasound technician. They use tests to detect, diagnose, and treat diseases injuries or physical conditions. In these positions, you need to follow instructions and procedures and have strong skills in evaluating and reporting. Another category is health informatics. Sample positions here include nurse manager and medical administrative assistant. People working in these roles manage patient information and healthcare-related computer applications. You must have the ability to analyze medical data. Another possible healthcare career path is in support services. Examples here include dietary technician and hospital maintenance engineer. These individuals work behind the scenes to ensure other healthcare professionals can accomplish their duties. You will need to be detail-oriented and organized. The final category is biotechnology research and development. These jobs can include forensic science technician and toxicologist. Employees in these positions have strong math and science skills and use science and technology advancements to improve healthcare. Now we'll watch a short video on the healthcare industry.
The healthcare industry is booming, and 10-year projections indicate continued strong growth. In fact, the U.S. Bureau of Labor Statistics projects that nearly 1 in 7 Americans will be employed in the healthcare and social assistance industry by 2028. The large population of aging baby boomers is often cited as a major contributor to this growth. As they grow older, many develop health concerns that require more care, increasing the need for workers to meet the demand. Technology and innovation are expanding the types of healthcare jobs available, as well as generating new products and services. In addition, changes to medical insurance models have expanded the number of people who obtain medical care. The primary function of the healthcare industry is to treat patients facing illness or injury, whether to cure or rehabilitate from a condition, to maintain wellness, or to provide comfort or palliative care to persons dealing with incurable conditions. A number of other industries relate closely to healthcare, including pharmaceuticals, biotechnology, and health insurance. In this industry, credentials matter greatly. Jobs are generally defined by the education, certification, and licensure you possess. For example, certified nurse assistant, licensed practical nurse, or registered nurse. Quick facts to know. Nearly 21 million people are employed in the healthcare and social assistance industry. Mental health care, behavioral health, and substance abuse services are expanding as they've become increasingly destigmatized. Telehealth developments continue to expand to make patient care more accessible and reduce staff involvement. Examples include wearable devices that measure and document heart rate and artificial intelligence nurse coaches. Wellness care to prevent illness and stay well is gaining emphasis, often by insurance companies seeking to minimize healthcare spending. Providers are increasingly measured based on patient satisfaction and outcomes. As more healthcare records and information are communicated digitally, protecting patient data is increasingly important.
Okay, as you can see, healthcare is a field with many opportunities and good growth.
We'd like to present to you our first presenter, Clarissa Neal. Clarissa is the Clinical Coordinator for Children's Dentistry Group. Welcome, Clarissa.
Hi, thank you so much for having me. As you mentioned, my name is Clarissa Neal, and I've been with Children's Dentistry Group for close to 8 years. And a look into our practice, we are a pediatric practice located in Lake Zurich, Illinois. Our dentists have been providing dental care to children and special needs patients throughout Lake County since 2009, starting off with only 300 active patients to now serving over 6,500 patients. Dr. Sarah Mahmood is the current practice owner. She purchased the practice in 2017 from Dr. Hare, It's Dr. Sarah's passion to help improve the smile of children, setting them on the best path towards proper oral health. And she continues to want to have the practice grow and be available in the community. Overall employment of dentists and dental team members is projected to grow 3% from 2019 to 2029. This demand for dental services will continue to increase as the population ages and as research continues to link oral health to overall health. That means there will also be a higher demand for even entry-level positions such as front desk receptionists and dental assistants. Below listed are some but not all of the skills needed for these entry-level positions. Our practice gives candidates with little to no experience the opportunity to receive on-site training for these positions, as well as education opportunities, CPR and first aid training, and full-time employees also have access to benefits such as health, vision, and life insurance, as well as paid time off. Benefits are offered after 1 year of employment. Entry-level positions into the dental industry are a great option for high school seniors and recent graduates who are either unsure about college or can't afford a college tuition right out of high school. These positions have multiple career path opportunities such as dental hygiene, teaching, dental supply reps, dental lab tech, dentist, and other specialties. For the admin, there is a career path such as treatment coordinator, insurance, and practice manager. In 2012, after receiving my GED from College of Lake County, I was referred to the Lake County workforce, who assisted me in getting into a dental assistant program at State Career College. That in turn helped steer me into the career that I have today, starting as an entry-level dental assistant at Children's Dentistry Group in 2013 to becoming clinical coordinator as of 2018. And I also do the office's marketing and supply ordering and inventory.
Clarissa, thank you so much for your presentation. I'd like to ask you a few interview questions.
Yes.
If you could please describe for us the growth opportunities in the field.
The growth opportunities in the field, from research, what research shows as of last year, I believe they have an expected growth of 3 to 4% due to more and more research connecting oral health to overall health.
Okay, thank you. What is the work environment like at Children's Dentistry Group? Can you talk to us a little bit about the environment of the work? Are you on your feet all day?
So that would definitely depend on the position. The work environment in general is indoor. It can be fast-paced for us because we're a specialty. It is a little bit more fast-paced. We have a higher patient volume. Front desk receptionists or administrative positions are typically, at the front desk, so they're not on their feet the majority of the day, whereas dental assistants are usually on their feet 60% of the day and then sitting chairside the other 40.
Okay. Please discuss with us what your typical work schedule looks like. Do employees have to work on holidays, or are there a variety of shifts?
So the nice thing, at least with our office, is once we've made your schedule, it stays like that indefinitely. And unless something comes up, life changes where you need to make adjustments. We are open Monday through Friday from 7:30 a.m. to 5 p.m., Saturdays from 7 to noon, which means our team members' schedule is usually 7 a.m. to 5:30, Monday through Friday, with a weekday off, and then Saturdays 6:30 a.m. to 12:30 p.m. And then we are closed Sundays, so everyone technically gets the 2 days. Holidays are slightly different for our office because we are pediatric. So spring break, so Easter, and any holidays that fall into a vacation time for children, it's typically our busiest time of the year. but we are closed on federal holidays, so Christmas Day, New Year's Day, and so on and so forth.
Okay. What are the most important skills and education needed for these jobs?
Definitely organization skills, communication, attention to detail, positive team player attitude, and problem solving would be the most important skills, I would say. And as far as education, at minimum, high school diploma or GED for the front desk. Dental assistant is the same, and we prefer if our applicants have gone to a short term, even if it's just 6 to 9 month dental assistant course, but it's not required.
Okay, thank you.
Mhm.
Okay, Clarissa, can you talk a little bit about typical entry-level wages for these positions? And if there are any other benefits that you haven't mentioned as well?
Yes. For front desk receptionist, entry level wages typically range from anywhere from $10 to $13 an hour. And also at times there is full-time positions available, and more often than none, it's usually part-time for front end. Dental assistants, it's a little bit different for them. Their entry level wage can range anywhere from $13 to $17 per hour, and those are almost all of the time full-time positions. Benefits for dental assistants, I had mentioned earlier about education opportunities. For our office, after 1,000 clinical chairside hours, we send our dental assistants to UIC in Chicago to receive their coronal polishing and pit and fissure sealant certification. And shortly after that, about a year after that, we do resend them again to receive their nitrous monitoring certification.
Okay. What advice would you have for candidates who might be interested in an entry-level position in dental?
I would say that if you're looking for a job that is going to push you and encourage you to keep going and acquire as much education on something as possible, this is where you want to go. Especially, it's much simpler to get into the dental industry with minimal training, minimal schooling, and then acquiring the knowledge and the skills as your career progresses. So I would just tell them that if this is truly what you are passionate about or would like to learn about, then it's a great opportunity. And opportunities in the dental industry change down the road hundreds of times.
Okay. What are the main difficulties you see with employees in this group who don't work out?
A lot of it is punctuality, attendance, and not fitting with the specialty. I've mentioned a few times we are a pediatric office, so not everyone can do pediatric. That was something my teacher at State Career College first day explained to all of us is pedo is not for everybody. So a lot of the times we sometimes have people that just are not equipped to be able to think and problem solve quickly to work with children.
Okay. And why would a young person want to work for Children's Dentistry Group?
My opinion, I believe, and I know our office has given a handful of young people anywhere from 18 to 24, and I believe I was 23 when I started. We give the opportunity to candidates who, like I have said before, just came out of high school or don't have any training or experience. and it's you invest in us, we invest in you type relationship. So we, as much as we appreciate, their hard work, we give back by opening the doors for them to expand the career.
And finally, Clarissa, what do you like best about working for Children's Dentistry Group?
The environment, the children, the patients. I love the specialty in general, just that there's, everyone has dental, not everyone, but there's a large amount of people who have dental anxiety, and to be someone that is able to help reverse that and make a child, whether they're 14 or 5, more comfortable to go to regular dental visits, that's it's a good feeling.
Oh, that's great. Clarissa, thank you so much for the
Thank you for
wonderful
having me.
information that you shared with us. And now I would like to introduce our second guest speaker today. Kiara Crothers is the talent sourcing specialist with Advocate Aurora Health. So welcome, Kiara.
Thank you so much, Maureen and Pam and Clarissa, for awesome information. So a little bit about who Advocate Aurora Health is. Formerly known either as Advocate Health or Aurora Health. We were 2 separate entities at one point, and now we've merged into one to become Advocate Aurora Health. So we're the 10th largest not-for-profit integrated health system in the US. Pretty impressive to say we're the 10th largest, even though we're located in only 2 states. We also been named top workplaces multiple years in a row, so pretty proud of that. And then just some general stats about us: over 70,000 employees, many nurses, many employed physicians, many physician partners. And another thing about us is we've actually been recognized across various specialties and departments for our clinical excellence. So typical entry-level jobs, I know that's a main question I get a lot, especially from the youth who are looking to get into healthcare and develop their career path within healthcare. But even though we're a hospital system, we're still considered a corporate system. So we have just about any job you can think of out there. We house office, clerical, and administrative workers, call center associates, patient transporters, patient service reps, which are the individuals who take your copay and verify your insurance, that smiling face you see when you go to the doctor who checks you in to see the doctor. Those are what our patient service reps do. And then, of course, we have CNAs, which I know Maureen talked about. Phlebotomists aren't on here, but we do have a phlebotomist training program. So that allows anyone who doesn't necessarily have the phlebotomist experience or certification yet to be trained right on the job into getting those credentials. We also have security personnel and food service workers who work in our cafeterias. And then, of course, our cleaning specialists that keep those hospitals and clinics nice and tidy and sanitized. So at a glance, just overall some career paths to go into. We talked about entry level, but there's a slew of them out there, whether entry level or more professional, and they include corporate positions. I'm part of corporate. I work in talent acquisition slash human resources. And then, of course, our clinicians, our pharmacists, our doctors, our nurse practitioners, of course, our nurses, LPNs, medical assistants, surgical techs, and the list goes on from there. So what do we look at in terms of your education and skills? No matter what position, most of our positions do require a high school diploma or a GED at a minimum. There are some exceptions to the rule. Some of our food service assistant positions do not require a high school diploma. As a matter of fact, I believe that we can employ some high school students in some of those positions. So, far and few between, but for the most part, our minimum requirements are a high school diploma or GED. I want to talk about this next point here. We are a hospital system, so naturally we are a very patient-focused system. So take someone, for instance, like me, who works in an office. I don't necessarily have patient contact, right? But, I'm a healthcare worker, and essentially I share the same mindset as the mission of our organization. And that's really to keep people well, to have patients top of mind, to really promote a well caregiving environment for even candidates we bring into the company, and just really having that empathy factor overall, no matter if I sit in front of a patient or not. So I share that with you guys to say, you can be coming into a role that doesn't necessarily have patient interaction, but still we expect you to have the mindset of promoting health and wellness. Computer skills are needed for most of our roles, especially now with COVID. There are a lot of things that have been transferred to remote or telehealth. So we do want you to have some sort of computer literacy. Again, some roles may not fall under this sector, such as our food service workers who don't necessarily use the computer, but many of our roles do have some sort of computer literacy that's needed. Positive attitude team player, eager and willing to learn, and that flexibility and longevity factor. I want to share that we have so many opportunities to grow. After 6 months of employment, if your heart desires, you are able to move into other departments and other positions. So we actually love promoting from within. So if you're one that loves flexibility and longevity, we love to give it to you. And then just some additional behaviors that align with our core values: collaborates and communicates effectively, values differences and fosters resilience. I want to chat about this for just a second. We are an organization that obviously has a very diverse patient population that we serve. So because we serve such a diverse patient population, naturally we like to mirror that on the inside of our organization, right? So if we mirror who we serve, then that builds our integrity, it builds our diversity factor, and all that good stuff. So naturally, we want people who value differences and foster resilience to join us in our organization. We do enjoy individuals who ensure accountability and also who exhibit courage. Benefits offered. I'm just going to touch on a few of these because I know this is kind of a long list, but just some highlights. We do offer a very lucrative tuition reimbursement program. Matter of fact, part-time individuals are eligible for tuition reimbursement as well. There is a number of hours requirement within that in terms of how many hours you need to work to be eligible, but the benefit is there. Just kind of telling you a dollar amount, we offer up to $5,000 for full-time employees, and I believe up to half of that amount for part-time. And then for more of our lucrative and specialized programs, such as nursing and some other technical programs, the benefit is increased to up to $7,200 per year. And then also just some other things that we have in terms of benefits and perks. We have both a flexible spending account in healthcare and childcare. And then also we do employee appreciation every year. And that's where, we all kind of get together and have food catered in. It was done a little bit differently this year with COVID, of course. So we did a lot of virtual games together. We had virtual bingo for one of our employee appreciation events. We had mocktail hour where everybody kind of grabbed their mocktail and we did fun things together. So a lot of different fun things that we do for employee appreciation. And then lastly, I just want to touch on the sign-on bonuses and referral bonuses we offer. Many of our specialized positions do offer sign-on bonuses, some even up to 5,000 plus sign-on bonus. And then also referral bonuses, I believe, are up to 2,500. So what is the typical hiring process with us? So typically, I, as a recruiter, would reach out to you after you've applied or after I found you on Indeed or our job board or some kind of way came across your resume. I may set you up for an interview if it sounds like it's a good match between you and us. And then if that interview goes well, you may be set up to meet with the hiring manager and their staff. Typically, it would be on site, but due to COVID, we're doing it all by video. And then, of course, if you're offered a position with us, we would proceed with the necessary screenings: drug screen, criminal background check, pre-employment physical education verification, and all that good stuff. But if you have any questions about what's out there in terms of our job openings, remember we are both in Illinois and Wisconsin, so you do want to be mindful of which state you select to find the appropriate openings. But our website is www.advocateaurorahealth.org. And then for questions for me, I am always happy to help. I know Maureen and the team will be happy to get this information out to you guys, but for the sake of verbalizing it, it's kiara.carruthers@aah And I know Maureen and Pam have some awesome questions for me that will help answer some questions for you guys. So I am all on board for answering any questions Pam and Maureen you guys have for the group.
Okay, thank you so much, Kiara. Could you talk a little bit about career paths for young adults?
Sure. Yeah. So I think that was on an earlier slide. I don't know if you can flip back, but we talked about some of the entry level positions, such as the patient service reps, the call center association, or excuse me, the call center associates, the security personnel, and then also the housekeeping environmental specialist. And actually, you don't need experience in healthcare or experience in general for any of those roles. A lot of individuals think that, oh, I'm going into a healthcare organization, I need to have healthcare experience. Not at all. For our entry level positions, we do train and we do not require experience. So definitely there's opportunity to grow into healthcare from there. And then if you are looking to grow from entry level, there are so many different opportunities. Like I said, after 6 months, you certainly can grow. You can be building your education while you're working for us. We have a lot of nursing students who work for us and start out in a position until they get their nursing degree and may ultimately progress into being a nurse after they get their degree, but they're still earning that healthcare experience as they go. So, you know, to answer that question with the short answer is there's so many different things you can do within us.
Okay, could you talk a little bit about typical career path in terms of maybe someone wanting to become a CNA, certified nursing assistant?
Absolutely, absolutely. So, my main focus for recruitment is actual medical assistant recruitment for the company. And I will tell you that a lot of individuals I speak with, the natural progression is generally to start out as a CBRF, which is like a home caregiver. Many of those folks move from a CBRF role to a CNA, certified nursing assistant, and then from there into a medical assistant, and then from there into a nurse. And that's not set in stone, but that is what I see a lot of. That's generally a natural progression. So again, a home caregiver, which is also identified as a CBRF, into certified nursing assistant, into medical assistant, and into nursing. And then the sky is the limit from there. But that is generally what I see a lot of. And it just goes to show you how again, you don't need to have had extensive healthcare experience to grow into a healthcare career. I think for the most part, the core is really having that patient-centered focus for anyone that goes into healthcare.
Okay. Could you talk a little bit about the work environment for some of these positions?
Sure, absolutely. So, of course, it is going to be based on, and I think Clarissa even answered a similar way with some of her work environment and positions, but it is going to be based on the clinic site and the specialty or department. And I'll give you guys an example. A lot of times, if you're a medical assistant, for instance, or a nurse going into an urgent care or ER setting, naturally you're going to have to be ready for all hands on deck, expecting the unexpected, very fast paced, moving and shaking, all that good stuff. But if you are a caregiving professional or entry level person going into like a dermatology department, you'll find that those tend to be a little bit more moderately paced. So it really just depends on which department you go into. And actually, that gives you something to think about. If you are someone who is progressing your healthcare career, you definitely want to be mindful in learning the different types of paces and environments for the different departments. Because if you know who you are, and if you know what environment you thrive best in, or on the opposite end of the spectrum, don't do well at all, that's really going to put you in a better place to decide which department and specialty may work for you.
Okay, could you talk a little bit about typical work schedules? For example, is there holiday work, shift work?
Absolutely. So because we have both clinic sites and hospital sites, hospitals, as you probably know, they're open 24/7. Our clinic sites, on the other hand, usually are open only during daytime hours, for instance, 7 to 5 or 8 to 5. So if you're a individual who goes into one of our hospital sites, be prepared to work first or second or third shift. And then if you're an individual such as a medical assistant who's housed at our clinical sites, your typical day is going to be like an 8 to 5 Monday through Friday or something similar. Urgent care clinics, on the other hand, generally those are open from 7 o'clock in the morning till 8 o'clock at night. So although not as late as hospital, you still could be someone who works in the later evenings if you're at our urgent care clinic.
Okay, and what are the most important skills and education needed for these jobs?
Yeah, absolutely. So once again, and repetition is key. But once again, talking about that patient-centered focus factor, right? That people factor, definitely needed for us. I can't stress that enough. That I want to say something too. If you think about healthcare, and even dentistry that Clarissa talked about, many times I hear that healthcare is not just a job. Dentistry is not just a job. You're going to have a natural passion to want to help people, whether it means making their smile better, or just keeping them well, encouraging them when they're facing hard circumstances. So, I think a lot of healthcare and everything within, including dentistry, really comes from an innate passion, and it's not something that's taught. So those soft skills that you really just are passionate about, I think it really starts there. But if I could speak on skills that are needed aside from those soft characteristics, would be, at least a high school diploma or GED. Punctuality and attendance is important, and just really having that flexibility, because healthcare, there's always, changing times, the unexpected. Look at the circumstances we're in now with COVID. I will tell you that lately I've been recruiting for CNAs when I've never done CNA recruitment before. And that's just because there's a lot of switching gears where we have to help each other out and all come together with all hands on deck, because certain departments are struggling with all of the patients and the changes and things like that. So just be ready for the unexpected, be flexible, be moldable, be teachable.
Thank you, Kira. What are the typical entry-level wages for some of the positions that you shared with us?
Absolutely. So they fall right in the 14s to 15s for entry level. And then, of course, depending upon your skill and experience, it can go up from there. But that's a general ballpark.
Okay. And what is your advice for candidates interested in an entry-level position?
Absolutely. So I always like to tell people research, research, research. Google is out there free of charge, right? Internet Explorer, although that's becoming kind of ancient, they're out there. All those search engines are out there. So do your research. Research different career paths, characteristics that are ideal for those paths. What does the environment look like? You guys asked me about hours. What does the schedule typically look like? So do your research. Don't get into something that is not really going to work for you. Do your research on companies. Glassdoor is a great example of how employees really voice their opinions about what they think about the company they work for. So we are at a blessed stage here in this day and age where we have these resources right at our fingertips. I think, my parents growing up didn't have all these things for us, or for them, excuse me, but we have these things where we can really find out about a company and their reputation. It's important for you to know, what can this company do for me, just as we want to know what can you do for the company. So it's a two-way street. Just do your research.
Okay. What difficulties do you have with employees in this group not working out?
Similar to Clarissa with attendance. We have an attendance policy for our hourly employees where there are points assessed anytime that you're either absent or tardy. So unfortunately, we do lose some great employees due to attendance. A policy is a policy, so we can't really run into, this person gets off the hook where this person doesn't. We can't really do things like that. We run into legalities like that. So if there's a policy in place, just try to be mindful of that. But and then I want to kind of touch on something that Clarissa mentioned, just, working in pediatrics is a good example. She talked about, we have pediatrics as well, and we have ER. So going back again to saying what I said before, and to piggyback off of Clarissa, is really understanding the nature of the patients that you're dealing with, so that you don't set yourself up for failure. Geriatrics is even a great example when you're dealing with more senior patients who may deal with dementia or memory loss. You want to be mindful that patience is definitely key with that, because a lot of times you're dealing with a whole other situation when you have to be mindful of people who may not remember that you have to constantly tell them over and over because of their memory loss. So that's why I say research is so important for you to just go out there and see what different industries entail working with children. Clarissa, thank you for mentioning that is a whole different situation. So don't set yourself up for failure. Really know where you thrive and where you don't.
Okay. And why would a young person want to work for Advocate Aurora Health?
Absolutely. So, just going back to the fact that we're one of the top workplaces several years in a row. We're a very large health system, the 10th largest in the U.S. I will tell you that this company is definitely like a family. It's almost like my home away from home. Just the other day I was on a cell phone call with my boss and I felt like I was talking to my sister. They promote such a family environment. They promote appreciation for their employees. Hence what I mentioned about the appreciation week every year. I will tell you something too that, I promise it's public information. It's out there. So I'm not telling you any secrets, but for COVID, our CEO and other leadership members actually purposely took a pay cut for a while because they used those dollars that were cut from their salary to fund our employee fund, our employee relief fund. So many employees who were either furloughed or who had family care situations because of COVID or any financial setback, the CEO's sole purpose was to fund dollars for our employees to be able to dip into that fund and take advantage. So, they do things like that. The company doesn't look at its employees as just a person or an individual. They look at us as, significant people who contribute to the organization, and naturally they want to contribute back to their employees. So just amazing stuff. I don't think I ever worked for a company that has done just things like that. We get random videos from the CEO where he'll just talk about updates and give us, some knowledge to think about, some words of encouragement, and it's just him talking. And it really promotes a very human feel because when he gets on these videos, it doesn't feel like a lecture. It doesn't feel like if I can make you guys laugh, a pony show. It really is him in human form. Just being the humble self that he is and really talking to us like we are his brothers and sisters. It's just an awesome, awesome company to work for.
Thank you. And finally, what do you like best about working for Advocate Aurora Health?
Oh man, I probably answered two questions in one. I'm sorry, Pam. But yeah, just going back to what I said, I think just a wonderful team, where we all kind of dive in and help each other. If I'm struggling and overwhelmed with something, I can go to a team member and that team member will say, hey, what can I do? What can I do? And that's just how we all are. Like we're just naturally drawn to each other, I think, because we have similar personalities. We all care about the mission of the organization, which is keeping people well. So you really feel that amongst all members. And I say that also to say that it just goes to show you how the company stands behind its mission in hiring like-minded people who support the mission. Because if you're a person that doesn't stand behind patient care and empathy and people factors, you just won't get hired. And I hope I'm not sounding abrasive, but that's really just saying that the company stands behind its mission with hiring people that will ultimately promote the mission of the organization. And it shows.
All right, great. Thank you so much for your wonderful presentation and for participating with the interview questions. It's been very helpful for us.
Thank you so much. I appreciate all of you.
Thank you.
All right, so one of the last resources that we'd like to share with you is at lakecountycareers.com. It's a great resource where you're able to discover more about opportunities in healthcare. You'll be able to look at career resources, career paths, and learn more information regarding our Lake County careers. Thank you so much for joining us for this presentation.